We will discuss primary hyperparathyroidism when it does not cause symptoms, a condition referred to as asymptomatic primary hyperparathyroidism.
In these cases, there is often a question of whether surgery is needed or if the condition can be managed through monitoring. Surgery is not always required for people without symptoms, but it can still be beneficial for some, especially if they are at risk of their condition worsening over time.
Most people with asymptomatic primary hyperparathyroidism do not experience significant progression of the disease, meaning their calcium levels, bone health, or kidney function may remain stable.
However, some people may develop complications, and identifying who is at risk is key. For example, surgery can help improve bone health or prevent kidney stones in those more likely to have these problems. Guidelines exist to determine when surgery is recommended for asymptomatic individuals. If someone has even one of the following issues, surgery is often suggested: a blood calcium level more than 1 milligram per deciliter, 0.25 millimoles per liter, above the upper normal limit. Bone problems, such as low bone density with a T-score of -2.5 or lower, or evidence of a spine fracture that has not caused symptoms. Kidney concerns, like poor kidney function, an estimated filtration rate under 60 milliliters per minute per 1.73 square meters, high calcium in the urine, more than 250 milligrams per day for women or 300 milligrams per day for men, or a history of kidney stones or calcium deposits in the kidneys. Being under 50 years old, since younger people are more likely to have complications over time. Even if surgery isn't mandatory, some people choose it because it is the only permanent treatment for the condition. When deciding between surgery and monitoring, the risks and benefits are considered. Surgery is the definitive treatment and can improve bone density and possibly quality of life. However, many asymptomatic individuals can be safely monitored for years, as long as their condition remains stable. For some, though, the disease may worsen, with higher calcium levels, new kidney stones, or declining bone health. Studies show that bone density might decline after about 8 to 10 years of observation, so very long-term monitoring may not be the best for everyone. In summary, for individuals with asymptomatic primary hyperparathyroidism, the decision to proceed with surgery or choose ongoing monitoring depends on the presence of risk factors, overall health, and personal preference.
It's important to work with a knowledgeable healthcare provider to decide on the best plan for long-term health.